Rosemary, we're live.
No, don't tell me that.
We're live.
Really?
It's happening.
Well, I was in the mirror when I got up this morning, so I knew I was alive. So here we are.
Here we are.
Yes.
Together again today.
Yes. And ready to go.
I'm excited.
I'm excited too. I hope there's a lot of people out there that there's information we can give to, and that we can maybe satisfy some of their needs and help them live a better life with this disease.
Right? That's
Yeah.
the goal.
Yes.
So, tell us, Rosemary, a little bit about your career. We've established you're 39
Yes.
and you have 60 years of experience.
Yes.
So, tell me about how you got that experience, what you've done in your career.
Well, when I started out deciding what I wanted to do, you were either a teacher or a nurse. So I thought I would take the easy way and be a nurse. Well, the first year I wore my feet out, so that goes to tell you. I went to school in New Orleans, to a Jewish hospital school of nursing, although I'm not Jewish. And I went to Tulane University for my subjects. I think when I realized I really liked to work with people, I was doing a psychiatric, how do you call it, stay at a psychiatric hospital to learn psychiatric nursing, which they don't do that anymore. We lived there for 3 to 4 months. And after the end, we had our evaluations, and they said to me, Rosemary, you mix so well and fit right in with all these people. Well, I didn't know at 19 if that was a good thing or not, but I thoroughly enjoyed it, and I enjoyed listening to people. Since then, I was your first area vac nurse before area vac nursing had even been thought of as a thing to do. I was the first nurse in Snowflake in northern Arizona, being the RN for the paper mill. So I worked with a lot of men, and I'd meet them on the street corner in Snowflake, and we would go to the hospital, and of course we would fly them down to the valley. I was more worried about the ambulance when he got here, because that far back, they didn't have shocks on those ambulances, and they weren't soundproof. So I knew for sure that I was going to have a nervous breakdown before I got there. After that, I worked in a doctor's office. I delivered many, many babies. The Indian ladies liked to come to this doctor, and we had WEPACs, and we had lots of fun. It was fun. Then I made it to the valley. I've been in the hospital doing medical surgical nursing because I felt it was important to know the illnesses so that I could stay, focused. After that, I got into geriatrics a little bit more. I've been here for 21 years doing what I like. I like problems. I like to help people solve problems. I like to listen to people talk. The bad thing in our world with the health system, ordinary people can't go somewhere and talk to somebody and just throw it on the wall and let it all out because it costs too much. They don't have $300 for a session or $150 for a session. And when you're dealing with this disease, you don't have extra money. So I'm hoping that I can fill that gap so that I can help you. And if I don't know, I'll let you know I don't know, and I'll find an answer for you. And that's it. And I'm still working because I know if I stay home and do nothing, that I'll have cognitive impairment also.
So you're just working.
So I'll probably work right before they do away with me, whatever that is.
Right.
Yes, and I do enjoy it.
And this is your favorite job you've had, right?
Yes, it's my most favorite job. I
And
think it's fulfilling
wait,
what I did.
Everybody needs to know.
Yeah.
And I'm your favorite boss, right?
You've been a boss here a long time. Yes, you are my favorite. It's a nice place to work. I wouldn't be here for 21 years if there wasn't something I liked. I enjoy family members. I enjoy people who have cognitive problems. I don't greet them like that. I get inside their dementia and we laugh, we have a good time. And to me, that's what life's for.
It's true.
So they want to be treated with dignity and respect. So if you go in to treat someone with dignity and respect, you get so much out of it. I cannot tell you the days I've had hard times and it's lifted me up, Or I'll come to work and somebody will tell me a problem and I'll think, I don't have anything to be worried about.
Right.
They've got a lot better problems than I do.
Yeah.
So
Well, we have launched Real Talk with Rosemary as of today. So we have taken you out of what you've known as your job for the last 21 years, as just the nurse and the supervisor of,
I'm lost.
yeah,
It was a different feeling when I woke up this morning because I've done this for so long, and I had success with it. And everybody wants to know, why don't you just retire? You had a good thing going. And I thought, well, I think I'm going to have a good thing going in the future. I'm doing something different, something I never thought I would do. I've always taken the pictures of my family. I'm never on camera, so this is a big leap for me to be sitting here being photographed.
Right.
That's just really a hard time because you can't touch me up. It's just live. So
but you're brave
I'm brave.
and you're bold.
Maybe a little stupid, but I'm brave and bold.
So not only are we going to be doing this, so we'll have every other week we're going to come live so people can ask you questions and we can take the gift that you are and share it with other people. But then also people can now meet one-on-one with you and do a one-on-one session with you.
And you just don't realize how important that was. I have people long ago would come in, I'd be working on the Saturday extra, nobody knew I was here, I thought, and they would find me and come in from out of state or wherever. You just learn so much. Somebody's gonna listen to you. I'm not gonna criticize you, we're gonna see what we can do to help you. And when your family's driving you crazy and you're the only one doing care, but everybody else wants to tell you how you do it, come in here, because I understand. We'll put them in their place.
So people can find out about that on our website, www.oakwoodcreativecare.org. And you have your own webpage now.
Yes,
You're like the real deal.
I am a real deal.
Yeah. But we got to make it official. Like
Okay.
your real dealness is not yet official
No,
until this moment, right now. Because I have something for you.
this is,
Which will make this whole thing official. Are you ready?
No, Sherry, you've done some big surprises.
I know, I'm kind of surprised
You have to watch this woman. You
you
really do.
stuck around with me this
Oh,
long.
Well,
I haven't driven you out.
she hasn't driven me there yet.
Okay.
What do we have?
So this inside this box is what's going to make you official.
This is official.
Mhm.
Can I open it?
Mhm.
Let's see what it's gonna be. Oh, Oakwood. You know, I feel like royalty. You know, when they get married and have a baby, they get their face on a cup. That's me.
Now you have your face. on
Now
the
I have
cup.
my face on a cup. I have arrived.
Right?
Hollywood is here. So,
So
Thank you,
now,
Sherry.
when we have our Real Talk with Rosemary, we can use these
we can use these and not
as
these.
our cup.
Thank you, Sherry. That's really nice.
Isn't that fun?
Yeah.
Maybe we'll autograph some and
Yeah.
and send them out here.
Well, you know, I teased my family. I had a little paper about me, and I teased them at Christmas time and signed it for them. So we've had a lot of laughs out of this, but it is serious business. I hope that we can help a lot of people and answer some questions.
And have fun while we do it.
Oh, I always have fun. If I didn't have fun, I wouldn't be here. I just have fun. My face sometimes looks a little stern, but I enjoy myself.
I know when I first started here, I thought you didn't like me.
Well, I had to learn you, and you had to learn me, so.
Right?
Mhm.
That's awesome. All right, Rosemary. Who is your hero? Who would you say is your hero? We're going to do a little get to know Rosemary.
Who is my hero? Who would be my hero? That's really hard to answer. I think my hero would be a lady way back. That's when I started in nursing school. I learned a lot from her, unlikely one to really like, but learned a lot of values from her, and I think that would be it.
Hmm. All right, if you could live anywhere, where would it be?
Well, I've been here for so long in Mesa, and my family's all here. I guess I'm happy here, but I might like a beach area that has, I like the beach. I like Pismo Beach. My husband, when he was alive, we went there a lot with the kids, and probably go to the beach a lot, maybe the Caribbean. I think that'd be fun.
Yeah, that would be fun.
I'd take more vacations. I'd like to take more vacations and go to the water.
Yeah.
So, my grandson takes me to Europe, and I really like that. So anywhere I travel, I'm happy.
Okay, here's a good one. What is your biggest fear?
The one I'm right now, I'm gonna bomb out on.
I had a feeling. But
Because this
you're-
is really stretching it for me, so. I always thought I couldn't do things if I didn't know everything. And I think now I found out that nobody ever knows
Nobody
everything.
knows anything. Yeah.
So if you stop thinking that way, I think you won't hold yourself back. You'll try some things that you didn't think you could do.
Right. Well, I think you're very comfortable in a support group and in teaching,
I
But-
love to teach, yeah.
but being on camera is
Yeah.
probably the thing
Well,
that makes you most
I
uncomfortable.
think when you all send me questions, that will get me in my comfort zone, because that's what we do in our supports groups right here in this room. I have them, and in fact, at the end, I have a tip for you that one of the caregivers brought in, and I'll leave you with a tip for the day towards the end of the program.
All right. So, what I think would be good is to talk about the two top most. Wow, I need to work on my interviewing skills.
That's all right, you're learning.
Right?
Mm-hmm.
We're learning as we go. Okay, so the two most frequently asked questions that you get from family members.
One, they want to know what they can do to get sleep. General public, I believe, thinks that your husband lays down, or your wife or your loved one lays down at night and goes to sleep, and you get up the next morning and repeat it. No, you don't. It goes on all night and all day, and that's what caregiving is so difficult. So trying to find people a way to get a little rest, a little relief. The word respite means to get away from something that's difficult or hard for you. I remember when I first heard that word, I hadn't heard it before, I think they just invented it, but I helped them try to find some respite. And the second question they asked me is about communications. How do you communicate with somebody? And that's a biggie, because if you can get past that one thing and understand it and not fight it, then it's so much smoother for you and for your loved one. You can change, but he can't, or she can't change.
You know, I love, a lot of times we'll do trainings on communication, and we bring in an improv person, because really the same rules for improv match with working,
Yes, they do.
communicating with somebody with dementia,
And the caregivers love it.
right?
It's one
It
of the
is
most
fun.
popular things that we do.
So the number one tip is to never say no. It's yes and.
Yeah, the no goes out of your vocabulary, because people kind of get their backs up when somebody says no. And so if you think that your loved one is already having problems understanding things, getting it across what you're meaning, when you say no, that's very negative, and you're going to get a negative response for it. So you need to throw that out the window. You need to get into their world. That's a little harder than what it sounds, but you got to get inside their world and go with the flow. I'm a nurse, but I don't act like a nurse. I had a lady in the program, I went by her, and she said, well, I want to go upstairs. I didn't know upstairs here that I found, so I just looked at her and I said something that probably, I don't know, another nurse would probably say that in public. I just looked at her and I said, I've got to go pee, I'll be right back and we'll go upstairs. She laughed so hard because I said that out loud in front of all these people. She hollered in laughter. So I went to the bathroom and came out, and she just smiled. She did not remember she wanted to go upstairs.
Yeah.
So if that's what it takes from me, that's it. Get in there with them. Or I'll say, yeah, I've got to go upstairs. I'll be glad that you can go with me, but I've got some work. If I don't get done, I'm going to get fired. Well, that made sense to that person, and of course they forgot it. They were directed to something else in the program to do, and he didn't dwell on that. It's not always that easy. Finding that one thing that works with your loved one is extremely difficult. And if you haven't found it yet, don't be worried. A lot of people haven't. Some people think they have, but if you can go through all the stress, and you can remember not to say no, and you don't be calling your husband or calling you his daughter, or I've never seen you before in my life, and just get in there in his world, and you'll find it's much more comfortable. A lot comfortable.
Yeah. You had an article, where is it? And I love the title of it.
Oh, the one on the caregiving? Yeah.
Right there, on the bottom.
Oh. I just found this, and this lady, I've been thinking this, but I just didn't have the nerve. The title of this little thing she wrote is, "No, caregiving is not rewarding, it just simply sucks."
Right?
So, if you think staying up 24 hours a day, cleaning up, you know what, a couple of times a day, then you'll understand it simply sucks. So this lady has wanted to say that. So she says, instead of trying to sugarcoat it, how about offering caregivers some real support? So that's what Real Talk is. I will offer you real support. I won't back away from it. I'll tell you when your doctor doesn't know what he's doing besides what he's telling you. We'll look at medication. If he's on 12 medicines, I'll send you back with your medicines and say, you need to talk to your doctor. This is not normal. And let him see what medications that he can get rid of. I will go there with you, and we'll figure it out.
We have a question online. Can you talk about what a good medical team should look like?
Well, first it would be a group of people who communicate with each other. It just doesn't stop with the one person. The team communicates together. If you're an older person, hopefully you found a gerontologist. Gerontologist. That's why we have her here. She knows the big words. You'll get along a little bit better. But you have to have a team that's going to listen. If your doctor is not listening to you, then you need to find a new doctor, because it's not going to work. If you don't understand what he's saying and telling you, then it's not helpful for you. And remember, you're paying his salary. You're paying vacations. So you need to get who you like. And we talk about that a lot. I have lots of hints in my support group. I wish you could come to support groups with me. And we hit all those things. We even talk about hospitals and rating, and you probably didn't know they had ratings.
It's true.
Yeah.
And maybe we can cover that in another conversation. But so you recommend a gerontologist.
Mm-hmm.
What about a neurologist?
If you have cognition problems, you most definitely will have to see a neurologist to be sure you have a good diagnosis. If you figure 20% of the diagnoses are incorrect, you got to be sure what you're being diagnosed with. So if you have a good general practitioner or a good internist, whoever you had, he's listening, doing these things, then he would send you to a neurologist. He would know to do that, and then get whatever it needs to be done at that time. There's really some good geriatric psychiatrists now who I've been really pleased with, and they've done a lot for behavioral control. And simple things.
Yeah, but it's not as easy as you might think to create a good team.
It's very difficult, because you have to have people who want to give you the time, the doctors that want to communicate with each other. It's very difficult. One of the hardest things that is to navigate the medical community. But you can do it.
It's possible.
Yes, it is possible. Yeah, I've had a lot of success with people, and it is possible.
All right, so speaking of people getting misdiagnosed, and I think there's a large misconception about what dementia is, what is dementia versus Alzheimer's. Most people are getting the diagnosis of mild cognitive impairment. So talk a little bit about that.
Well, first I'm going to tell you, I know if I put it here, you see it upside down, so I'm going to read it. I give these little pieces of paper out to everybody that comes in. It tells you what dementia is. And I'll tell you up front, if you go to the doctor and he says, well, your husband has dementia, he didn't tell you anything. Because I'm going to tell you what dementia means, and I'm going to read it. Dementia is a term used to describe the symptoms of a group of illnesses that cause a progressive decline in your mental functioning, your reasoning, your remembering, those type things. There are a variety of causes, and the most common that we face in the United States is Alzheimer's disease. So it's not a disease, it's just a word to describe the symptoms. So if there's over 100 different types of dementias, and your doctor says, oh, you have dementia, he really didn't tell you anything. So you're going to have to press him, or that's when you should be asking for a neurologist to see what type of dementia do you have. Do you have dementia because you drank all your life, a beer a day? Do you have it because you have a frontal lobe, you're having behavioral changes? Do you have it because you have Parkinson's disease and now you have Alzheimer's from mixed with Parkinson's disease? Many. Or you may not have any of that. You may have a thyroid problem that they haven't picked up. Or you could have a deficiency in a B12. Or you could have a tumor. I had a gentleman that diagnosed with Alzheimer's probably 10 years ago. I knew something wasn't wrong. We sent him back to the doctor. He died, I think, in about 4 days. He had a brain tumor. So you're going to have to get diagnosed to be sure what you're dealing with. Maybe you'll luck out and it'll be something, and it will not be, it won't be one of the dementias that we can't help.
Right. It could be as simple as dehydration.
It could be simple as a dehydration, but usually that, hopefully a doctor can pick up. But some simple things they just don't pick up, and sometimes you have to be careful with the diagnosis from the neurologist. They're not all created equal. My biggest, from people, they'll tell me they just really don't talk a lot. Well, a lot of them do talk a lot, so you're going to have to get one that's going to explain what's going on with your loved one. We've found many people here that have been diagnosed wrong, and that's very not good because they're on wrong medication, which just compromises your quality of living.
Yeah. Mm-hmm. All right. So all over the news right now, everybody's talking about the coronavirus. So we had somebody ask a question. What should we as caregivers do for our loved ones regarding the coronavirus? What is Oakwood doing in preparation of the coronavirus? And where do you get reliable information and status about it?
Okay, this is very simple. If you have not got the flu shot, don't be asking about the coronavirus. We know the figures for the flu, and this is a peak season for flu. December through February are peak season. So if you haven't got your flu shot, go down and get it. It takes you approximately 2 weeks to get some help. But you're worrying, people worry about things that are new and they don't understand. The flu is not new. We really understand it, but still, we won't go out and get the flu shot. And you have a lot more people that are ill right now. I was reading a statistic that in Ohio, let me find that one. Oh, Sherry, I don't know. In Ohio, they have 3,642 cases of the flu, which you can get a shot for, and they've had a death. You don't have that many people that are ill with this coronavirus. So if you're worried about your loved one and he doesn't have the shot, you need to get him out and get his shot. And you need to get the shot, and your family knows, so that you don't get the flu. it's bad. It gives respiratory problems, it gives pneumonia, a lot of different things. So you're risking dying from the flu by worrying about this other virus. The other virus, we don't know a lot about it. We know that the only thing you can do is keep your hands washed, don't touch your face. I think if it got real bad here, I wouldn't go to the movies. I don't go to the movies now when it's well, I don't go to the movies, but I try not to go to large gatherings of people because people cough and sneeze, and that's a sure way to get sick. So get your flu shot, and then you won't have to worry so much about anything else. It's now we think it is spread by coughing and the droplets from your.
It's okay.
You know, it's from your nose, coughing and those type of
Right,
things.
so
You need
universal.
discharges. So it's the things that you know to do. Wash your hands 20 seconds. To go in and for a couple of seconds and wash your hand and dry them off, not gonna do anything. Use hot soapy water, dry them off. You can get some of the alcohol-based, what is it called? Like Perel or any of those, and wipe your hands if you don't wanna wash them all the time. You can do that in between. If somebody is sick, keep them home. If children are sick, keep them home. What are we doing about it? We ask people to please get their flu shots for their loved ones, and generally people are pretty good about that. If you have a fever, we do not want you to come here. You stay home. If you have a cough, a new cough, I prefer you stay home till we can see what it is, if it's just a cough, or if it's due to maybe the flu. Or if you have the flu, don't send your husband because you know that he's already been exposed to it if you haven't had your flu shot. So that's about all that you can really do. If you can go to the Maricopa County Health Department, they will have updates, and I'm sure the TV is gonna have some updates.
When they send
Local
us
news,
updates as well,
Yeah,
since we're
they'll send us
licensed.
updates, and if we see something that's different that you can do, then we'll let you know.
And what is today's tip of the day?
Today's tip of the day. There is a product. This morning we had a meeting. Here they are. This morning we had a support meeting here, and one of our ladies brought in Gorilla Grip Slip Resistant Leak Proof Mattress Pad Protector. And this thing is a gorilla use. She's been using this. Her husband is extremely incontinent. It's like an ocean in the bedroom. So she puts it on, she can lap it under the mattress, so if he were to urinate on the side of the bed, it's gonna catch it all. And she uses several of these. They're not real expensive. I just learned this morning. They're $19 for a 52 by 34 inch pad. They will absorb 8 ounces of fluid, which is pretty good. So
Hey,
here,
that would work for you, Tara, for those who are trying to potty train.
well, they even use them for dogs. They put them down for dogs and then to go there, because 8 cups is a lot.
That is a lot.
But you could put this on your bed, and in addition to what other things you have on there, what you're trying to do is sleep at night. You don't want to have to get up in the middle of the night and strip the whole bed, because your husband is going to be all upset and you're never going to get back to sleep.
Right.
But you can use these pads, different ones, and then there's another little pad you can put over it, and that might help you. I really might want to go online. I think she said she got hers on Amazon, but it's called Gorilla Grip Slip Resistant, and it doesn't slip. I think that's what I liked about it. It stays put. So that's your tip for the day.
I love it.
Mhm.
Well, that was fun.
That was fun.
We did
We
it.
made it.
Cheers
Good.
to us
Cheers to us and my new cup.
and your new cup.
Thank you, Sherry.
Yeah.